In the 1970s, 80,000 of Flint's 200,000 residents were employed by General Motors at the massive car manufacturing plant Buick City. These factories polluted the river with nearly 26.5 million gallons of waste each day. In 1967, Flint realized that its water supply from the Flint River was dangerous and switched to the Detroit Water Service to meet the needs of a growing population.
In 1940, General Motors started a slow transition out of the city, building new factories exclusively in suburbs. By 1960, 8 new manufacturing plants were opened, and none of them were in Flint city limits. By 1980, General Motors had almost entirely moved out of Flint. All of its remaining 20,000 workers were laid off, depleting Flint's tax base and ultimately resulting in bankruptcy. The only thing GM left behind was an acidic Flint River and desolate factories. This stripped agency from the people of Flint and contributed to environmental crisis.
Multiple institutional actors contributed to disinvestment, segregation, pollution, and urban decay that impoverished Flint, making its citizens politically disenfranchised. A tremendous number of middle-class white residents fled cities for the suburbs, creating a wealth vacuum in Flint. The Homeowners Loan Corporation and Veterans Administration offered extremely cheap loans to white Americans, allowing them to rapidly build sprawling suburbs. The Federal Housing Administration created maps using different colored lines to designate areas where banks should refrain from investing. These maps redlined the now predominantly black neighborhoods of Flint, preventing residents from selling their homes. Additionally, federal regulations at the time allowed lenders to deny loans to people of color. This policy made it nearly impossible for black families, even black men returning from war, to leave the city. Today's crisis is the direct result. The debt that Flint rapidly accrued after these institutional shifts robbed Flint of its agency.
In April 2014, the city switched its water supply to the Flint River. In September 2015, Dr. Hannah Atisha releases her research on elevated blood lead levels in Flint's children. In October 2015, the state reanalyzes their data and declares a public health emergency. In October 2015, Flint switches back to Detroit Water. In December 2015, Flint announces the use of third-party water testing. In December 2015, the Flint mayor declares a state of emergency, and the state pledges $10 million to help Flint. The community was the main actor in garnering media attention and trying to bootleg immediate solutions to the crisis. Citizen scientists were an incredibly important part of providing initial data to prove the existence of the problem, despite denial by the governor of any issue with Flint water. After official help was slow to come, community coalitions were formed around the idea of helping people to get clean water. These included groups such as Water Are You Fighting For and Flint Water Class Action, which organized people and distributed bottled water to residents.
Leanne Walters is a Flint resident and mother who was the original whistleblower on the crisis. After noticing a rash in her sons, Garrett and Gavin, she contacted the city of Flint about the brown color of her water and the sickness it caused. The local government sent Mike Glaskin, who found lead levels around 300 parts per million, 20 times the safe limit. Miss Walters had her children tested, and Gavin was found to have lead poisoning. She stopped using the water and began trying to piece together different roles of the many culprits: Governor Snyder, the Department of Environmental Quality, and the emergency manager.
Miguel del Toro worked with the Virginia Tech scientist Mark Edwards to continue testing Leanne Walters' house, while she gathered information on the Department of Environmental Quality's failure to establish corrosion control methods to mitigate the disaster. The EPA contacted the state government, but they said they needed more time to finish the completion of the water supply switch, so the EPA dropped the matter altogether. The report was not discovered until it was leaked to the media by Kurt Goyette of the ACLU, who received the report from Del Toro.
As an institution, the EPA failed to act responsibly by not following up on research after high lead levels were discovered, and by believing the state's stance that nothing was wrong with the water until it was too late. In doing so, regulations on clean water and the sanctity of human health were abandoned in favor of good press. The EPA is responsible for setting and enforcing drinking water quality standards under the Safe Drinking Water Act and the Public Water System Supervision Program. This program states that if water is found unsuitable for drinking, the EPA has to work with states and public water systems to remove the contaminants and inform the community about the danger. The Safe Drinking Water Act has 2 sections that the EPA also violated during the Flint water crisis. Section
1414 states that the EPA is responsible for issuing an order to comply to the state if they have not taken action to mitigate their violations within 30 days of discovery. Section 1431 states that the EPA has authority to overpower the state's rule when the water issue poses an imminent and substantial threat to human health. When Leanne Walters reported high levels in Flint water of lead, the EPA contacted the Michigan Department of Environmental Quality, and we were reassured by them that it was an isolated incident due to Flint's optimizing corrosion control program, which actually didn't exist. Because of this, the EPA dropped the issue, which caused them to be in violation of all three of those programs mentioned.
A 5-person investigative committee was appointed to figure out who was at fault for the crisis. They concluded that the state government played a major role. The MDEQ failed to require Flint to treat their water after they switched its source, failed to investigate the correlation between illness and the water quality, and didn't follow laws that required control of erosion to minimize lead levels. The agency knew that there was evidence that the water was contaminated, but they continued to tell Flint's residents that it was safe to drink. It also misinterpreted federal regulations about treating the water. The Department of Health and Human Services failed to promptly respond to outbreaks of illness. The task force mainly blames Governor Rick Snyder's office, which was aware of the crisis for months, but relied on incorrect information from state officials on the Flint water situation. The American Civil Liberties Union revealed that passages regarding the contamination were removed from a government specialist report.
The task force went after the city's emergency manager, who was appointed to solve Flint's financial problems. The emergency manager had the power to replace and overrule decisions made by locally elected officials. The move from GM signaled the extent of the institutional failures underlying this crisis. The corporation and the revenue that it provided the state was seen as more important than the health and safety of the people living in Flint. The people, when they requested a similar switch back to the Detroit water supply, were denied and reassured that the water was safe to drink, despite the glaring evidence from GM complaints of corrosivity that this was far from the case.
Despite heavy coverage of the developing issues by local media outlets, the water crisis in Flint did not gain national media attention until Michigan Governor Rick Snyder declared a state of emergency in January 2016. Because it took nearly 2 years for the crisis to debut on national stage, it has been regarded by many as a serious failure by the national media in bringing this issue to light. The complexities of a crisis that combined government mismanagements with detailed science meant that the story wasn't nicely packaged and easy for journalists to jump on, but instead involved untangling a mess of events and key information. Since the national media puts a vast amount of pressure on public officials, earlier coverage of the crisis could have potentially resulted in faster solutions in Flint.
Rationale for the switch from Detroit to Flint water was to save the city money overall, with a projected savings of $5 million. This action was taken quickly, without research into the quality of the new water supply, or if the city's infrastructure could handle it. The switch was also ordered by the state governor, Rick Snyder, and the city's emergency manager, completely bypassing the democratic process of the city council and the will of the people.
As the extent of the damage was discovered, the price of fixing it skyrocketed. As of the end of September of this year, expenditures by the state to mitigate the Flint water crisis topped $170 million, 34 times the expected savings of the switch. All of the money has still not solved the crisis. The people of Flint still do not have clean water over 2 years later, and the government refuses to put in new infrastructure to provide more help.
Environmental racism happens when environmental degradation, hazardous pollution, and other harms are intentionally placed in non-white neighborhoods. Often, this happens because targeted communities lack the economic and political agency to fight against locally unwanted land uses. Flint was targeted when urban decay and disinvestment left the city under the control of an unelected emergency manager. This manager, who was appointed by Rick Snyder, used Flint's economic hardship to create tax breaks for corporations. He didn't represent the people he was serving, and the system that brought him to power gave little agency to the people of Flint who were impacted by his decisions.
The water crisis in Flint, Michigan resulted in part from institutional failure on many different levels and exemplifies why institutional hybridity is crucial to preventing similar crises in the future. Not only was there a lack of communication between key regulatory agencies charged with testing the water sources in Flint, but within the DEQ itself, there were found to be conflicting reports about whether adequate corrosion control programs were in place. Particularly, there was a massive debate about the meaning of the lead and copper rule, published in 1996 by the EPA, about how corrosion control treatment procedures apply when there is a new water source and treatment process. Moving forward, it is extremely important to incorporate key ideas from institutional hybridity in order to prevent future institutional failures. Particularly, there should be nested responsibility and clearly defined roles for all of the actors, including regulatory agencies, all levels of government, and the community. Actors should be working collaboratively and transparently to prevent further miscommunication and lack of immediate action. Furthermore, power should be distributed equally between the policy, regulation, and delivery to prevent a single actor from carrying all of the responsibility.
The federal government can take part in penalizing the state actors who contributed to the crisis. This could be in the form of fines on those who polluted the river, on those who decided to change the water source in the first place, such as the emergency manager, or the MDEQ, which failed in following regulation and being transparent with the public. The EPA needs to be restructured with more defined roles and responsibilities for cases with localized problems, since its role in such cases is vague. If its role becomes more defined, the EPA and the federal government will be able to take action sooner and can also ensure state and local governments comply with all laws and respond quickly to health problems. The EPA should push a program to reduce contamination levels in the Flint River in case of necessity of using it as a drinking source in the future. The governor said that the state has taken dozens of actions to change how they will react to such crises in the future to hold themselves accountable. These include increased sharing of knowledge across state agencies and openness to outside researchers. The MDEQ is now testing water in schools and collaborating with the city and deferral partners. The state government could also improve their consulting of experts and transparency with the different levels of government. Furthermore, the state government could allocate funds to the city of Flint to completely replace the existing water infrastructure with non-lead pipes, which would be the only definitive solution to preventing further crisis. All local government solutions are really ways for the city itself to push back against state actions. Ideally, the law enabling the state government to appoint emergency managers would be appealed. Until that is the case, the local government and the community can work together to try and make their voices heard. A recent example of local action by the community includes plumbers installing water filters for free in people's homes to protect them from the contaminated water. However, this is only a temporary solution.